What are the early signs Duopa is needed? When it comes to managing Parkinson's disease, knowing when to consider a treatment like Duopa can be crucial. Duopa is a gel from Carbidopa and Levodopa that is delivered directly into the small intestine. It is often used for people who experience significant motor fluctuations despite taking oral medications. So, what are the early signs that might indicate the need for Duopa? One of the first signs is experiencing daily motor fluctuations. This means having at least 3 or more hours of off time each day. Off time refers to periods when symptoms like tremors, stiffness, and slowness return or worsen. This happens as the effects of oral levodopa wear off. If you find that these off periods are becoming more frequent or longer, it may be time to discuss Duopa with your healthcare provider. Another sign is inadequate control of symptoms despite trying other Parkinson's medications. If you have already used dopamine agonists or monoamine oxidase, B inhibitors without achieving stable symptom control, Duopa might be a suitable option. It is important to note that Duopa is typically considered when oral medications are no longer effective. Additionally, if you respond well to levodopa but struggle with inconsistent absorption or short durations of benefit from oral pills, this could also indicate the need for Duopa. The gel formulation allows for continuous delivery of medication, which helps improve absorption and reduces variability in symptom control. Before starting Duopa, a surgical procedure is required to place a tube into the intestine. This procedure is usually recommended for patients with advanced Parkinson's disease who have significant motor fluctuations despite optimized oral therapy. In summary, the early signs that Duopa may be needed include experiencing daily motor fluctuations with 3 or more hours of off time, inadequate symptom control despite other medications, and good overall response to levodopa but with problematic fluctuations. If you notice these signs, it is essential to consult your neurologist or movement disorder specialist. They can help evaluate whether Duopa therapy is appropriate for your specific situation, considering the benefits, potential side effects, and surgical risks involved. Remember, each person's experience with Parkinson's disease is unique, so personalized medical advice is always the best approach.